The medical care of infants and young children is more difficult because of their inability to communicate with the doctor. Yet most mothers can tell whether her baby is hungry, wet, sick or in pain because she learns to understand and recognize the baby's cry. The pediatrician should also recognize the sounds children make, for in pediatrics those sounds may help in the diagnostic process. Textbook descriptions of various pediatric illnesses draw attention to characteristic sounds made by children with specific illnesses or defects, as in the hoarse cry of a cretin. In this record, many characteristic sounds are presented. The first sound is the strong, lusty cry of a full-term normal neonate, birth weight 5 kilos. The recording was made a few minutes after birth. Compare that with the cry from a premature infant weighing 2 kilos. It is obviously much weaker than that of the full-term infant. Next, the 3 cries which mothers soon recognize. 1. The cry of a hungry infant. 2. The cry of an infant in pain. 3. The pleasure sound of a happy and contented baby. When a premature infant grunts and there is rib recession and an elevated respiratory rate and cyanosis, hyaline membrane disease is suspected. On auscultation, air entry is diminished and fine crepitations are present throughout the lung fields. An X-ray of the lungs shows a characteristic ground glass pattern and air is seen outlining the bronchi, giving an air bronchogram. And here is the typical grunting respiration. This is the sound of a child with laryngotracheobronchitis. In stridor or croup, it is always important to exclude diphtheria or an inhaled foreign body. Cystic fibrosis, a disease inherited as a Mendelian recessive, is characterized by chronic respiratory disease and malabsorption. The infant often passes pale, bulky, foul-smelling stools because of the associated pancreatic insufficiency, and there is failure to thrive. There is also a marked increase in the electrolyte content of the sweat. Cystic fibrosis is due to widespread changes in the mucus-secreting glands of the body. When it occurs early in infancy, the children often cannot cry without coughing. Infants with a vascular ring may have a soft cry because the esophagus and the trachea are compressed, causing maximal obstruction to expiration. This recording was made when the infant with a vascular ring was angry and crying as loudly as she possibly could. This is the typical expiratory bronchospasm and wheezing from a child with a severe attack of bronchial asthma. The following sounds were made by an infant with severe pneumonia. Note the grunting, near-mechanical sound of the crying and breathing. One can almost hear the bronchial breathing in this example. The cri du chat, or cat cry syndrome, due to a 5th chromosome anomaly, is characterized by severe mental and motor retardation, microcephaly, rounded faces, and hypertelorism. This is the typical cat-like cry. Cerebrally damaged infants have long been known to have a high-pitched cry. It should be noted that children with kernicterus, acidosis, hypoglycemia, or cerebral infections, such as meningitis, also commonly have high-pitched cries. Here is the high-pitched, laughing cry of a severely mentally retarded child with microcephaly. The child with hydranencephaly also has a high-pitched cry. In this condition, the cerebral cortex, except for the inferior temporal and mesial occipital lobes, is a membrane filled with clear fluid. The basal ganglia and the thalamus are present. The cerebellum and brain stems are well preserved, but the aqueduct is generally obliterated. The size of the head at birth is normal. The infant is well formed, but obviously defective and blind, and may have poor temperature regulation. Diagnosis is readily established by transillumination of the head in a dark room. There is no treatment. This is the cry. Down syndrome or Mongolism, also known as trisomy 21 syndrome, is characterized by an oriental cast to the eyes, broad bridge of the nose, protruding tongue, open mouth, square-shaped ears, and a flattened facial profile. There is also mental retardation, muscular hypotonia, and frequently associated congenital heart disease. Because of the generalized hypotonia, the infant cannot cry very loudly. There is a characteristic spasmodic cough in whooping cough, followed by the characteristic whoop, hence the term whooping cough. The condition is caused by the infective organism Bordetella pertussis. Here is the typical cough. When infants who have suffered from severe kwashiorkor recover, a small proportion develop persistent tremors which cease spontaneously. These tremors are similar to patients with Parkinson's disease. Their cause is unknown. They may be due to a temporary disturbance in basal ganglia function. When these children cry, it sounds very much like an old automobile with starter trouble. Infants with congenital hypothyroidism or cretinism are physically and mentally sluggish. They are usually pale, cold, and constipated. Their tongues are large and there is hypotonia. Umbilical herniae occur frequently. Bradycardia is common and the reflexes are sluggish. There may be nasal obstruction with persistent nasal discharge. The child fails to thrive. The protein-bound iodine is reduced and there is a marked delay in bone age on X-ray. A hoarse cry is characteristic. The following sound is that of an infant with snuffles. This is generally due to mucus, but congenital syphilis, cretinism, and diphtheria must also be borne in mind. The forced artificial cough of a 10-year-old boy who wanted to stay out of school and fooled his doctor very successfully will be heard next. He even had a bronchoscopy to exclude an inhaled foreign object. The psychiatrists often call these children honkers. They cough for a particular reason, usually to get out of school or to avoid examinations, and may present a difficult diagnostic problem. Psychogenic coughing should be borne in mind when faced with a persistent cough with no obvious apparent cause. Bronchiolitis is a serious illness usually affecting children under 2 years of age. There is widespread inflammation of the bronchioles. It is more common in winter and often attacks well-nourished children. Severe cyanosis, respiratory distress, dyspnea and prostration are characteristic. There is marked hyperresonance on percussion of the chest and fine crepitations and intense airways obstruction on auscultation. Most cases have now been shown to be due to an infection with the respiratory syncytial virus, or RSV. There is usually, but not always, a persistent spasmodic cough, almost like that of whooping cough, but without the whoop, like this. The De Lange syndrome, also known as the Brachman-De Lange syndrome or Amsterdam dwarf syndrome, is characterized by mental retardation, bushy confluent eyebrows, an upturned nose, wide upper lip, hirsutism, skeletal abnormalities, and delayed growth. The children are usually well below the 3rd percentile for both height and weight. A low-pitched, growling cry is often present. The prognosis is poor and death is usually due to respiratory infections or aspiration. In this 3-year-old, the cry is not typically growling, but it is very immature. The trisomy E, or Edwards syndrome, also known as trisomy 17-18 syndrome, is due to a chromosomal abnormality in the 17-18 group. The infants are small, with severe mental and motor retardation. There is a prominent occiput, overlapping of the index finger over the 3rd finger, and frequently occurring facial abnormalities, including micrognathia, Grecian nose, low-set ears, and cleft lip and palate. Mental retardation is usually severe. Frequently, rocker bottom feet are found as well as a short sternum, small pelvis and a genesis of the bones of the extremities. Congenital heart disease and renal abnormalities are also common. Listen to the seagull-like cry of an infant with this condition. These children usually do not survive beyond the first year of life. Lipoid proteinosis is a rare metabolic disturbance transmitted as a recessive trait. A structureless hyaline material made up of a carbohydrate-protein complex is deposited in the affected skin and mucous membranes. Lipids appear as skin lesions become more advanced. These skin lesions may be present at birth but usually develop later. They characteristically consist of yellowish-white papules which coalesce into plaques or nodules. Eventually, there is extensive involvement of the mucous membranes of the tongue, lips, oral cavity, pharynx, larynx, and rectal area. The course of the disease is usually benign, but a tracheostomy may be required when the vocal cords are extensively infiltrated. Infiltration of the cords precludes speaking above a whisper, and the voice grows hoarse from an early age.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15.
Metabolic acidosis occurs as a result of abnormal retention or production of fixed acids. This can occur in infants following diarrhea, starvation with ketosis, salicylate intoxication, diabetes with ketoacidosis, and in renal insufficiency. Compensation occurs through hyperventilation, and the infant presents with deep sighing respiration. There is often an associated high-pitched cry. Puberty varies widely in age of onset. The following physical changes are recognized as evidence of abnormally early sexual development. 1. Breast enlargement before 8 years. 2. Menarche before 10 years. 3. Pubic or axillary hair before 9 years. 4. Enlargement of the clitoris or penis disproportionate to the age of the child. 5. Other associated phenomena at an early age, such as facial hair, acne, change in the voice, pigmented areolas of the nipple, and pigmentation of the sexual organs. Listen now to the deep masculine voice of a 9-year-old boy with precocious puberty.
My naam is Johnny Kibberu. Ek kom Ogaris af, Somerset West. Son is kar. Brood, tafel, koei, skoen, hoed, But vrouw, ik ga zondag vrijdag huis toe. Zondag.
This concludes the series of sounds in pediatrics. There are many other diseases, some common, some very rare, where the child's sound may be a valuable clue to diagnosis. It is hoped that this record will reaffirm the value of sound diagnosis in pediatrics, as well as emphasize the importance of a doctor's sense of hearing, even in this age of electronic diagnosis.